you very much for being here. And you will see that I have the sign interpreter beside me. Please do include her in the picture. I would be most grateful. I am very sorry for the delay in this media conference, and what I can say is I have just come from the Beehive, where I have been at a meeting of what is called ODESC, the Officials Domestic and External Security Committee, which was convened specifically to look at our cross-government response around the novel coronavirus. So you may be aware that group, ODESC, is a meeting of the chief executives or their delegates from a range of government agencies. We've already been working very closely with a number of government agencies on border measures, on the planning for repatriating New Zealanders out of Wuhan, and we are just convening today to have a good look at our efforts, and the meeting went on for somewhat longer than we anticipated because there was quite a bit to talk about, particularly the logistics of the planning for the flight going in to get those New Zealanders out of Wuhan. So as I've said to you before, we've committed to letting you and the public know about any updates we have on our planning. I can say that there is an awful lot of work going into the logistics of getting the flight into China with health staff to get the clearances for the people to come out of China, and then of course importantly the arrangements for those people when they arrive back in New Zealand. And we are pulling all that information together. The government will make decisions, and those will then be announced in due course when the package is finalised and all the decisions have been taken. What that meeting also confirmed is that the work we've been doing to date has been appropriate, effective, and in line with the pandemic plan that we have in place. And I should say, whilst the Ministry of Health is sort of the owner of that pandemic plan, it is very much a cross-government plan. And one of the elements of that plan is that, as appropriate, either a watch group or the ODESC will meet to assist with that cross-government coordination. And the main trigger for convening ODESC today was that decision earlier in the day by the WHO Director General to declare this as an international emergency and or a public health emergency of international concern, a so-called FEC, and spoke earlier in the day about what the implications are for that. But just to rehearse, it does formalise the international cooperation. We've already been working closely with international partners. It allows us to mobilise WHO and ourselves and other countries to mobilise resources to help low-income countries. And of course, it ensures that appropriate reporting happens through to WHO so that we've all got good information on which to base our decisions. Also pleased to say that we have testing available now for the virus in New Zealand being done by ESR. So it's great to have that test on shore, and that will slightly improve our times for being able to turn around the testing of any possible or suspected cases. So we have been updating the information on the ministry website on a daily basis. And again, I would point you towards that and encourage you and thank you for using that information as the basis for the information we get out to the general public. What I can say again is that the evidence that is emerging about the epidemiology of this virus is confirming the initial assessments. Its level of contagiousness is not terribly high. It's nowhere near as high as something like measles. And as we see the number of cases increasing quite significantly, all largely still in China, but the number of deaths not increasing at the same rate, it seems that the mortality rate for this virus is, we initially thought 2 to 3%. It's probably somewhere below that based on the current evidence now. But the good news is that it doesn't seem to be increasing, and it's nowhere near the level of something like a coronavirus, the SARS coronavirus or the MERS coronavirus infection. So I think that is all reassuring. And just finally, just to confirm that our efforts continue on a range of fronts. They will continue over the weekend and obviously into the week, and we will continue to keep you fully updated on any significant developments. So with that, I'm happy to take questions. With me, I have Dr. Caroline McElnay, who is the Director of Public Health, also here.
Can you tell us when that flight is going to be going ahead?
No, I can't. I can only point to the Minister of Foreign Affairs comments this morning, and he was saying that the planning was well advanced. But clearly, we will need to. There are a lot of moving parts here, and we'll need to make sure everything is in place before the flight can go ahead.
Can you talk about how the risk of transmission is going to be managed on the flight?
Well, we've given advice on a number of precautions that can be taken to reduce risk of transmission between the passengers on the flight, but also, of course, to protect the crew. And the main objective there being to ensure that if anyone is not symptomatic but might be infectious, that we don't transmit that infection on the plane. But there will also be pre-screening of people. So health staff will be going over and screening people getting on the flight to ensure that they are fit to fly.
Are the passengers going to be quarantined when they get back?
We're looking at all the options about what might happen there.
Do you know if it went ahead where they would be quarantined?
Again, we've provided advice to the government on a range of options there, and decisions are in the process of being taken.
When you say there will be pre-screenings, if someone is ill, are you going to leave them in Wuhan?
So someone needs to be fit to fly for whatever reason. If we feel they are unwell and infectious, and it's appropriate that they in fact receive medical attention there, then that's what would happen.
What about those who are stuck in the province but can't get to Wuhan to get the flight? What are you going to commit to getting them there?
So I can't commit to that, but I know that our colleagues at Foreign Affairs and Trade are working on all the options for New Zealanders there.
Are there any suspected cases in New Zealand?
We have one person in Auckland who is the closest to fitting a suspected case definition, and testing has been sent off. We won't have the results of that testing till tomorrow. What I can reiterate is the commitment the Minister and I made yesterday that as soon as we do identify a case, we will inform the public and media once we know.
National is quite critical that you're not expanding the screening of people coming into the country from not just direct flights to China. They say it's sort of a bit reckless. What's your reaction to that?
So I think 2 points I'd like to make here. The first is this morning in his declaration of that FEC, the Public Health Emergency of International Concern, the WHO Director General emphasised that border measures needed to be proportionate and justifiable. And at this stage, WHO is not recommending any restrictions on trade or travel. And our border measures, the provision of information in particular and meeting flights directly from China, are very consistent with those of other countries, including Australia. And as we know, the most important aspect of actually that is to ensure those people have information about what to do if they develop symptoms. What is clear is that from the over 6,000 people who have been given information coming from those flights, none of them are showing any symptoms or feeling unwell. So it's the measures happening in China before people leave that are just as important. We think our border response at the moment is appropriate and proportionate.
Does the ministry find somewhere to quarantine these people when they arrive?
Which people, sorry?
From Wuhan.
So are you talking about the people who are the New Zealanders?
Yeah.
So we've provided advice to the government on options for appropriate isolation of those people when they come back, and decisions are being considered about what to do there.
When do you expect to know?
Well, all the information will be communicated once all the decisions are taken, because there is quite a significant logistical issue being arranged across government. So the government will announce those decisions.
In terms of that person you said was the closest to a suspected case, I mean, you're saying that it's not a suspected case at the moment, but it could potentially turn into one?
Yeah. So the information I have is that this person fits the definition of a suspected case, is being managed appropriately, and the testing has been sent off.
Are you able to give us any more details about where this person may have been, which hospitals they've been in, anything that would be useful to the public?
No, I don't have any further information at the moment, but as I say, as soon as we've got more information, and in particular, whether or not this is actually a confirmed case, we will let the public know.
And it's in Auckland?
Yes, it's in Auckland.
Can you tell us what the main outcome of the meeting was this morning in terms of getting through these items?
Oh, you mean the ODESC meeting that I've just been to? The main outcome is that the commitment is clear, it is there, and it is a complex logistical exercise, and we are working across government to make sure that all the necessary steps are taken to be able to get those people here, keep them safe while they are coming, and also protect the Air New Zealand staff and crew who are bringing them back, and also thinking about what are the appropriate public health measures once they get back to New Zealand to keep them safe and stop any onward transmission for people of the virus if they're actually infectious but not symptomatic.
Is that meant to happen in the next week or so?
I can't give any details around timing. I can just point you to the comments made by the Minister of Foreign Affairs this morning.
If that one case in Auckland, it becomes a confirmed case in New Zealand, would that mean that New Zealand would have to ramp up to, was it level 3 of the pandemic plan?
So the pandemic plan has a number of phases, but there's not a bright line between each phase. So what we do know is that all the activities that relate to the current situation are appropriate in New Zealand. We've tested those. We've retested them against the advice that's just come out from WHO. In fact, we wouldn't necessarily change anything further to what we're doing. We have in place our advice in our hospitals about how to manage suspected cases, and if they're confirmed, how to treat them. And the clinicians are excellent on that. And our public health units, of course, are very used to and very good at contact tracing and putting in place appropriate measures around isolation of possible contacts. So we would just, the relevant public health unit would put those measures in place.
So it wouldn't move up to another level as such if a case is confirmed?
Not just on the basis of that case. Of course, what we're really interested in doing is identifying any suspected cases, confirming whether or not they are cases, and then stopping any onward transmission.
And if that may be suspected case, is that person in quarantine at the moment?
The person's in hospital and being managed appropriately.
So have they been separated from other people in the hospital?
Yes, so the normal management of someone who's a suspected case of an infectious disease like this is they have a special isolation room in the hospital, and it has what's called negative pressure ventilation. So basically that stops the possibility of the virus being carried out in the air, and the staff looking after that person follow very strict requirements around personal protection.
Is it Auckland Hospital?
Yes, Auckland Hospital.
Are you able to say if that person had travelled from Wuhan directly, or?
I don't have any further details at this stage, but just the information I have given you.
Can you say if they were a tourist or if they were New Zealand citizens?
No, sorry, I don't have any information on that.
You spoke this morning about how New Zealand has to move to containment and surveillance. Can you explain what exactly that means?
So I think what I was talking about was the general advice from the WHO to all countries, which is about, the key steps, which are about surveillance, which is, Caroline, you might want to comment here, but is actively looking for cases and ensuring we are keeping a really careful record of that, case finding, early diagnosis, appropriate management, then contact tracing. Caroline, did you want to just talk about what some of the practicalities are there?
I think Ashley's covered the main points there, and that was confirmed by the WHO advice for countries outside China. The main focus is being able to quickly respond to a possible case, and in order to do that, you do have to be alert. So it's about having systems in place to be aware of people who have symptoms, making sure that right from the beginning of the symptoms, they know what to do, they know to ring ahead and seek health advice, and then everything follows on from that.
And just going back to that maybe suspected case, is the immediate family of that person or people that they've been in contact with, what's happening with them?
So I don't have the details there, but of course, if it's a suspected case, then there would be, the public health unit would be immediately involved and be thinking about contact tracing, especially on the basis of the test result.
When did you say the test result would be?
The test result's due back tomorrow. I don't know exactly when, but rest assured we will be letting people know if we have a confirmed case.
Just to be 100% clear, has this person met the criteria for a suspected case?
So yes, this person has met the criteria. We have a case definition, which is on our website for a suspected case. And this is the first person that has been investigated who meets those that definition. There have been testing done on a number of other people, in a handful of people on a precautionary basis. None of those people met the suspected case definition, and in fact, even those tests that were done, they came back negative.
Did they come forward themselves?
That's my understanding, yes. And I think that's a very, very important message here I do want to give. It's really critical in these situations that people feel comfortable and empowered to come forward if they are symptomatic. And therefore, it's very important that there's no sort of blame or shame of anybody. And so that's a fundamental part of a community or a country being able to manage this sort of situation, is that people can feel comfortable in volunteering that they are symptomatic, because the system is very good then at kicking into gear and supporting them and managing them appropriately. Now we have that ability to do the diagnostic testing onshore that will indeed help with our response.
If it comes back positive, the test results, and they are a suspected case, if we have one suspected case, what's the chances that we have more?
Well, our key aim would be to stop any further transmission from someone if they were a confirmed case, and we just keep up our very rigorous surveillance and public messaging about people to come forward, seek medical advice if they have symptoms that they think could be a result of this coronavirus. I'm happy to take one more question.
Can you just confirm, sorry, this morning, you said if you give an MFAT options to where you could quarantine people, is that right? Or have you given it to...
We've given the advice to the Health Minister and other ministers, yes, and we've worked very closely with MFAT and other government agencies on that.
How many, sorry, can you just say how many options there might be?
No, I can't actually. Right, well, thank you very much again. I really appreciate your support in helping us manage our way through this situation, and we'll look forward to seeing you at the next conference.